today's video, we'll be going through the process of writing a prescription utilizing RxNT. To get to RxNT, go into your preferred browser of Chrome or Firefox, type in the 4 letters rxnt.com. It brings us to the home screen here. Note on the right, the 800 number is our help desk, or you can click on the word support to send them an email. Support is available Monday through Thursday from 8 a.m. to 6 p.m. Eastern Standard Time, and Fridays from 9 to 5 Eastern Standard Time. After hours and weekends are for critical issues only. On our left-hand side, you'll click on Customer Login. When getting to Customer Login here, you'll enter in your username and then your password. If you forget your password, you'll enter in your username and then come down to Forgot Password. Selecting this, it will then send you a link so you can reset your password. So I'm going to type in password here, click Enter or Login, and it brings us to the screen where we're able to select what application within RxNT we'll be using. Also note, at the top of the screen, Update Password, you can also change your password here once you get to this point. The passwords are, will not expire for a year, so you can reset them if you like. Note, if you're on your cell phone and you can't remember your password, you do have to come to the website to utilize that Forgot Password link. There is not the option to do so on the mobile app. From here, I'm going to select e-prescribing. At this point, it brings me to, as we see here, the prescriber dashboard. The screen that we see in front of us is the dashboard, and it can be accessed at any time by clicking on the word dashboard at the top of your screen. Here on our left, if we were to select menu, you're also able to access other applications of RxNT. Prescription Watch would bring you also to the dashboard. Note, if you come down further here, under Current User, you're able to see the user and then the physician. In this case, I'm both the user and the prescriber. For the nurses or MAs or staff, if you need to select a different prescriber, it will have your name as the user, and then beneath it will be a drop-down so that you're able to select a different prescriber. This is all found under Menu in the top left-hand corner of your screen. The menu bar is always located at the top of your screen. From here, we're on the dashboard. Our scheduler, that's another application within RxNT. If you're interested in utilizing this option, just let your sales representative know, and we'll be happy to set you up with enrollment forms. Next, Messages, an internal messaging system so that you can message any other users who have access to RxNT, as well as if you were to give your patients access to their patient portal, they can also message the practice. Tasks allows you to assign someone a task within the practice, or they can assign you a task. To your right, you're able to search for existing patients, either by last name or first name, or there's also the drop-down which provides you with additional search fields. If you need to enter in a new patient, you will click on the word New here in the far right-hand corner. When selecting New, the only fields that are required to enter in a patient are the shaded areas: first name, last name, date of birth, gender, address. Here on the left, typing in the street address and then the zip code. The system will then find the state and city, a contact number, and then scrolling to the bottom and selecting Add. This will allow you to add in a brand new patient. You can also, at the top here, enter in a patient's favorite pharmacy. This is all found when entering in a brand new patient. Please keep in mind, to the right, when searching for a patient, you're going to enter last name, first name, or the additional search fields and select Enter or the magnifying glass, not New. If you were to select New, again, the system will assume that you want to enter in a brand new patient. Now here in front of us, on the dashboard, we're able to view the status of our prescriptions. The recently sent, pending, these are scripts that have been placed in the pending queue waiting for a prescriber to review them. Refills will come over electronically versus phone or fax, and the voided scripts. Beneath it, right here in the center, we see a patient search. Again, this is not to look up a patient to write a prescription, but merely so you don't have to scroll through the list of recently sent, pending, or refills. Coming back to recent, this would allow you to see the patient's name, provider, approval date of when it was set up, the status of the prescription, and where it was sent. It will initially be marked in yellow, saying pending, and once the script goes through successfully to the pharmacy system, it turns green and has the timestamp of when it went through. This does not mean that the script has been filled. It also does not mean that they have that medication in stock. If it's a medication that you typically would call to confirm they have it available, you'll still need to do so. This is merely letting you know that that prescription has been received within the pharmacy system. Coming back to the left, if you were to click on the blue Rx box, it would then pull up a copy of the prescription that has been sent to the pharmacy. From here, you are able to see prescriber info, pharmacy information, patient information, the medication strength and unit, dosage, quantity, any comments. Generic is the default, signature of the prescriber, and any refills. Note, here on the right, underneath the date is also an ID number. If you have any questions about a prescription that's been sent for up to 7 days from the date sent, you can call into our support number, the 800 number that was listed on the home screen, and provide them with that ID number. They will then be able to assist you with any questions you may have or submit a ticket with SureScripts if needed. Back here on the dashboard under Recent, you can also click on the patient's name highlighted in blue, which will take you directly to that patient's profile. Above, coming to pending, these again are the prescriptions waiting for a prescriber to come in and review them, and they can either be approved, edited, or voided. Here we have the patient's basic information, the medication waiting to be sent, the provider, the entry date, and the intended pharmacy. Here, clicking on the blue Rx box allows that individual to void the script, edit the patient, change the pharmacy if needed, edit the prescription, keep it in pending, send, or cancel would just take you back to the previous screen. When sending, if it's a controlled substance, a box will pull up immediately requesting the user's password, the one that you use every time to log into RxNT, and the PIN generated by your token. You will not be able to send any level controlled substance without utilizing this token. Those scripts are found here under pending. You can also, by checking on the left, you can approve a script if it's not a controlled substance. You only have to click on the blue Rx box if you either want to edit the prescription or you want to send it and it's a controlled substance and you'll need to utilize your token. Next are the refills, again coming over from the pharmacy, where in the past they may have sent a fax request or a phone call. And last would be the voided prescriptions. Here you're also able to enter in a note as to why that script was voided. All 4 of these tabs are found on the dashboard. Going over to our far right, under Utilities, just to review, Utilities is your resource center. So from here, we've separated everything by the various topics. Here we have reporting capabilities, RX reports, EHR reports, meaningful use stage 2 report, EPA work list, and coming soon a MIPS report. Beneath that, under support, there's an online medication reference if you need additional info on a medication or an alternative. There's also the ability to reach out to our support team, our contact info, and our user guides. The user manuals here are for every part of the application, very simply created. They're PDFs so that you can actually open them online and toggle between the live system and the user guide. You can also print these off if needed. Beneath that, medication management, where you're able to create a free text medication, for instance, such as a comfort pack. You can add those in, adding in the medications that would be needed, as well as naming that medication however you'll know to recognize it under your favorite drugs. Immunization registry, further down, other user tools, adding in a patient. You can merge patients if duplicate records have been created. And here, specific to the individual user, custom SIG management. You're able to create a custom SIG which will pull up when searching for specific medication and strength. Manage favorites. You're able to set your favorite drugs. If you're using the EHR, the electronic health record, you also have additional options listed here as well. You can review the scheduled RX management. So if you have scheduled medications to go out on specific dates, either controlled or non-controlled, you're able to view them listed here. Beneath that, you also have the pharmacy management, and from here you can search for your favorite pharmacies and add them to the prescriber's queue. Beneath that, for those of you that need to obtain a token, all prescribers that want to send controlled substances of any level must obtain a token. A soft token is an app for your phone which would be uploaded, or you can get a hard token, which is very similar to a key fob. Has a small button on it. When you push the button, it will generate a unique 6-digit PIN. Those tokens are needed again to send out the controlled substances. You must obtain the token before you can send these electronically. Also, if you've sent in enrollment forms, that does not mean that you've already taken your ID proofing to obtain the token. You will click on Activate ePCS, and from here you'll be taking an ID proofing test, which is done through Experian. All information that's being requested is personal information. Please do not enter in the practice information. Again, it is looking for your personal info to verify that you are the individual that you are, and you should be receiving that token. Once passing, it will ask you again if you'd like the soft token, which is for your cell phone. Keep in mind, if you plan on e-prescribing from your cell phone, you will need to obtain the hard token. If you anticipate only prescribing from your laptop or desktop, then you can select either the soft token or the hard token. All of this has been found under Utilities. Now, to go ahead and prescribe, I'm going to come to the top right to search for my patient. Typing in the patient's name, you only need to put in a few letters of the first and last name. Select Enter or the magnifying glass on the right. Not new, again, or the system will think that you want to enter in a brand new patient. Here on our left, we have our patient's name, date of birth, if a chart number has been allocated, address, and phone number. To select the patient, you will click on the patient's name. Here it takes us to our patient dashboard. Note you always have the menu bar at the top of your screen. You always have the patient search to the right. So if this is not the individual you're looking for, you can go to the top right again and search for the other patient. Here in the middle, we have our patient's name and date of birth. To our left, when putting your cursor on the patient's name, it'll give you the basic demographics. Above that, there's an edit box. This is not to edit the patient's demographics, but rather if you want to upload a photo of the patient for ID purposes. If you need to edit the patient's information, come to the top left, select menu, and then coming down, you're able to edit patient. It pulls up the same information you saw when entering in a new patient. Here on our left, we have our navigation bar. So you'll want to think of the system almost as if you're looking at an email. The body here will have the majority of the information that you're working with, and on the left, we'll have the various folders or platforms. Starting from the bottom, clicking on Notes. With Notes, this is an internal notepad more or less. Clicking on the green plus sign would allow you to enter in a note, and then saving it, it gives us the date, who wrote it, the note itself. It can then, to the right, be edited by clicking on the file folder, or clicking on the red X will allow you to delete it. Again, these are just back office notes. They're not going to show up at the pharmacy, and they're not required for e-prescribing. Above that, we have problems. Again, not required for prescribing, but you're able to enter in the diagnosis, if you like, that associates with the prescription that you're creating. Clicking on the green plus sign, you can add in the diagnosis either by description, the old ICD-9 code, or the newer ICD-10 code. When clicking on the little globe icon, this provides you a link in both English and Spanish with additional information that you can provide your patient on the diagnosis. From here, on the far right, you can also edit or delete if needed. Again, you do not have to enter in a diagnosis to e-prescribe. Above that are allergies. As we know, allergies are important with e-prescribing in that our system will do an automatic interaction check, taking into account the problems or diagnoses if entered, allergies, any medications being taken by the patient, as well as age-based therapy and food interactions. To enter in an allergy, you will click on the green plus sign. From here, then, you'll enter in the allergy by allergen group, name or ingredient, and then select Save. In this case, I'm not going to add any in. You will want to note if the patient has no known drug allergies or no known allergies. That way, you'll have the date here on the right when that information was received. Above that is medications, and this is where we'll go to actually write our prescription. We have current, previous, history, and voided. Current is where we'll go to write the script. Beneath here, you can search for a drug, or you can go over to your favorite drug list, which can be created under Utilities under Manage Favorites, or the system will actually create favorites for you as you prescribe. Anything that you prescribe, it will add to that favorites list for you. Beneath here, it will list out the current meds for the patient. Clicking on the green plus sign, you can also manually update the current meds list. You'll want to enter in over-the-counter medications, supplements, medications prescribed by other providers. Also, it's included in the interaction check. If you needed to refill medication, simply highlighting the line from the left and clicking on Refill will allow you then to review the information and then either send to the pharmacy or place in a prescriber's pending queue. Coming back up again, our next tab over is Previous, and Previous will let you view the medications that have been prescribed through RxNT. Blue meaning active, the patient is currently taking them. So here we have the Augmentin. If we go back to current, we see it's listed there as well. Coming back to the Previous, remember this will show both active and inactive medications written specifically through RxNT. The gray would be inactive, or the patient is no longer taking that medication. You're also able to refill from here as well. You can print the med list. If you needed to discharge a medication, perhaps it was sent erroneously to a pharmacy, simply highlight the line from the left, select Discharge, put in the reason as to why you needed to discharge that medication, select Discharge. It keeps the history, but it turns that script from blue to a darker gray with a strike through, and that lets you know the difference between both active and inactive medications. If it's been sent to the pharmacy, please note you'll still need to call the pharmacy to notify them. The system will not notify them that you have discharged this medication. If you had erroneously discharged it but not yet called the pharmacy, you can reinstate it. You're also able to add to current meds as well as reconcile list, which will pull from our next tab, which is our claims history. The first time claims history is selected, you'll be presented with a HIPAA consent on behalf of the patient. This would fall under any written or verbal consent that's been given. It pulls per your patient's demographics, real-time claims medication history. When you accept, it would then allow you to view the provider, fill date, prescription, and pharmacy. This is within your state or another state, controlled or non-controlled. It is looking for a match utilizing your patient's demographics. Here on the left, selecting claims history pulls directly from the medication claims. If you were to select fill data, which I recommend going between the two to check, which will provide you with more information, this pulls from the pharmacy benefits manager. Keep in mind it's only for 2 years and it's for the patient's current carrier. From here, you can also, going to the right, refill a medication that's listed here, even if you are not the original prescriber, or you can add to current meds. So this way, you're able to keep that current med tab up to date. And last is our voided scripts, and these are specific to the patient. They're kept here as a reference. Going back to current is where we'll be able to write our prescription. So from here, we can search for a drug, or coming over to Fave Drugs, we're able to view a list of all the medications that have been previously written through the system. If one of the medications here is what you're looking for, all you'll need to do is click on that medication strength and unit. The icons listed on the left refer to the formulary key listed at the top. We just have the question marks listed here because my patient is a demo patient and does not have accurate demographics. When I click on the medication that I'm looking to prescribe, it will then drop me down further on the same screen. From here, I have the drug information. If I had created a custom SIG, it would pull and be visible here. Oftentimes, but not every time, there's a recommended SIG that can be utilized, or you can create new. To your right, it would provide you with alternatives, and above provides you with basic prescription coverage for the patient. Coming back to our left, we also have SIG Builder, which would guide you with drug-specific drop-downs where you're able to fill in the blanks to write your prescription. Reference provides you with the information typically provided to the patient at the pharmacy, giving you alternatives, uses, common brands, warnings, side effects. And last, when interactions, as we see here blinking in red, lets us know that there is a moderate to severe interaction that you need to be aware of. The system will never prohibit you from proceeding, but if severe enough, it will warn you several times. Here we're able to see that there's a drug-to-drug interaction. If we were to click on the blue link here, it would provide additional information on that drug-to-drug interaction. As we scroll down, we can see the other categories, and at this time, there's also a possible therapy interaction. Coming back up and moving to the left, clicking on drug information, here again, we can use SIG Builder to write our script. If there was a custom SIG, we could utilize the custom SIG, recommended, or create new. In this case, I'm just going to use the recommended SIG. From here, we see at the top the medication strength and unit. The dosage, which can be edited, are the instructions for the patient. You can enter in the maximum daily dose by unit or strength if needed. PRN selected, you're able then to enter in the description here on the right, quantity, and then unit. These are the only three fields required to write a prescription through the system. You can enter in day supply, but again, not required. Refills can be indicated for all medications other than C2s. Use generic is our default, so for brand or dispense as written, you would unselect, and I do recommend typing that in the pharmacist notes as well. You can save the SIG, so if we've made a change to our recommended SIG or the SIG we're writing, it will save it for future use. Pharmacist notes are any instructions for the pharmacy. Again, up top, the dosage are the instructions for the patient. Pharmacist notes are the instructions for the pharmacy. Diagnosis is a drop-down which pulls from the problems listed on the left. It will default to being blank unless you were to select from the drop-down. And last, scheduled gives you the ability, it's just an option, where you can delay a script if needed to process on a specific date or go into the provider's pending queue. And beneath that, you can also schedule reoccurring, which is very useful for when you have a medication that you're not able to do a refill for. Coming back up, over to our right, we see here add drug. This script more or less has been completed. Add drug is if you need to do additional prescriptions. So do not select add drug if you want to proceed with just the one prescription. Add drug is for additional. You can do as many scripts as you need for this specific patient at this time, just by selecting add drug. If you have multiple prescriptions and you decide that you needed to delete one, you can select a specific prescription from the list of those prescriptions that you want to delete. Continue is what we'll select in a moment, and that will take us on to our pharmacy search. And cancel would be no history of the script having been created and would allow you to start over again. So I'm just going to select continue. And from here, it will default to the state you're in. If the patient has had prescriptions written for them previously, they will be listed below, showing in chronological order of the most recent used pharmacy. To our left, we have prescriber favorites. So if you've added in prescriber favorites under utilities, under the pharmacy search, they would be listed here as well. Or we can search for a pharmacy. I recommend starting with either city or zip and then narrowing it down from there. The system is very exact. So one differentiation in writing in the name or the city or zip or the phone number, it won't find pharmacy. So it's much easier just to start off by typing in the name of the city and then searching. And then we can narrow down looking for a specific pharmacy. Now note here from left to right, the name of the pharmacy, the address, the city, state, and zip, phone and fax, and very important, anything listed here can receive electronic prescriptions. But if we were sending a controlled substance, it must have the checkmark EPCS listed on the right. If it doesn't, the system will not send that prescription through electronically. Now note on the left, The checkboxes are not to select a pharmacy to send to, but rather to add to the prescriber's favorites. So when selecting the boxes, click Add to My Favorites. It will then add those pharmacies to the Prescriber Favorite Pharmacy tab. In this case, I'm just going to go back to our patient favorites. Remember, when picking your pharmacy, you're going to click on the name of the pharmacy itself. This gives us a chance to review that prescription again. From here, we can still change our pharmacy, edit the prescription, save as pending. So if a nurse or MA or staff is creating the script for a prescriber and does not have authority to send out the non-controlled prescription on their behalf, they will click Save as Pending. It will then go in the provider's pending queue, which we saw on the dashboard when we first logged in. We can send, and we can also cancel again, and there'll be no history of the script having been created. Beneath that, you have print options. You will not select any of these unless you intend to print the prescription. So keep in mind, if you're sending it electronically, there is no need to select anything on the print options. Beneath this, we can review the interactions once again by clicking on the blue bar that has interactions. To our left, you're able to view the prescription. You can confirm all the prescriber info is correct, pharmacy, patient information, medication strength and unit, dosage quantity, any comments. Generic is the default, any refills, and the prescriber's signature has also been loaded as well. If you were to print an original, there would be no signature on the prescription. It would have to be signed by the prescriber, and there would be no pharmacy listed either. So at this point, if I'm ready to send my prescription, I will click on Send. It then adds that medication to my patient's current med list. So I see the Abilify has been added. And if I come up top to Dashboard, when selecting Dashboard, it takes me back and I'm able to view under Recent, it shows it marked in yellow. Disregard that it says fax. It's just because this is a demo account. You'll be sending electronically. Typically, it takes between 1 and 5 minutes to send that prescription over to the pharmacy system. As I mentioned at the very beginning, it does not mean the script has been filled or the medication is available. It just means the system's in the process of sending that prescription request over to the pharmacy. Now to do a refill, we'll go ahead just as another example. I'm going to select a patient's name, select Enter, and from here on the left, clicking on the patient's name. It brings us to our patient profile. Brings us first to our current meds, and from here, if we want to refill a medication that's been listed, we'll just highlight the medication, come up to Refill, and from here we're able to review the information, make any changes if needed. So perhaps we're going to go ahead and add in refills. To the right, Add Drug is to do additional, delete selected if we had multiples and needed to delete a specific prescription. Cancel would be no history of the script having been created, or we'll click on Continue. When doing so, it then shows us immediately our patient's favorite pharmacies, but we can always go over to prescriber favorites or search for a different pharmacy. I'm just going to go ahead and click on the name of the pharmacy I want. And from here, I can again view my final information. Then I can either change pharmacy, edit prescription, save as pending, cancel, or send. And when I select Send, it adds that medication to my patient's current med list, shows the last time, meaning today, that it was filled, and actual start date, the original prescription date. If I come back up now to Dashboard, we'll see that it's listed also under the Recent. So currently they're both in the process of being sent. And as soon as they are, they'll be marked in green with the date and time that they went through. This completes a basic overview of how to write a prescription within the RxNT system. For any additional questions, keep in mind you can always call support. That number again is 800-943-7968 and select option 4, or clicking on the word support will send them an email.